What's the very first step that you would recommend someone taking as a high net worth individual, a high success leveled individual, someone that's either running a company or a top level executive?
Pick one thing to measure, whether that's the number of fitness training sessions that you do on a year, whether it's the quality of your sleep.
Welcome back to the Primal Reset Podcast. Today, we're joined by Dr. Justin Greiwe and Dr. Ryan Collar. Justin is a board certified allergist, an immunologist, and a workplace wellness innovator. He's helped shape the future of preventative health through his work at Quotient Health and the American Academy of Allergy, Asthma, and Immunology. From leading research in food allergy to redefining corporate wellness, he's at the forefront of blending clinical science with whole person care. And Dr. Ryan Collar is a facial plastic surgeon, a healthcare leader, and the co-founder and CEO at Quotient Health. With a background from Johns Hopkins and MIT, he's driving innovation at the intersection of medicine, leadership, and holistic care. Dr. Collar, Dr. Greiwe, it is a pleasure to have both of you. Welcome to the show.
Thanks for having us.
Thanks, Eliot.
So walk me through real quick, Justin first, walk me through what got you starting Quotient Health with Ryan and getting you into being an entrepreneur.
Yeah, actually, it all started over a conversation at dinner a couple of years ago. We kind of started talking about books we were reading and parts of medicine that were annoying to us, and it kind of evolved into this longevity discussion. And we both had an itch to kind of do something new. Ryan, of course, has started other businesses in the past and has that entrepreneurial itch. So I think that kind of led us down this path to really reconsider what primary care can be. We see the deficiencies and we see the frustration that a lot of physicians have in this space. And so we really designed and tried to come up with a business plan and a practice model that we ourselves would like to be a part of. And so it started with that initial spark, and it led us to this point in our partnership where we're rolling out a new practice model called Quotient Health.
Ryan, share with me a quick 60-second summary of your story as well.
Sure. So you mentioned I'm a facial plastic and reconstructive surgeon, and also an entrepreneur, as Justin mentioned. And I think, as Justin said, this kind of started with just a dinner conversation. We both had been observing a lot of the same things, kind of both, I think, in our practices, but also just our personal lives. So I just continuously notice people coming to us for care when they've kind of missed a lot of opportunities to get in front of things from a proactive perspective. And it kind of wears on you over time to work within a very reactive healthcare system. And then personally, I myself needed to kind of get myself back into better health. And going through training and practice wears on you as an individual. And I went to try and go and find a solution to help me become more proactive with my own health. And it was just so siloed and just very scattered, the marketplace. You've got all these different solutions, but it was actually really hard for me, even as a physician, to find a path forward on how to take control of my own health. And that led to just a lot of reading and research and putting a lot of these pieces together that Justin and I have sort of culminated in what our model is at Quotient Health. So it's kind of solving a problem for what I saw in my own practice, but also trying to solve a problem in my own life.
I love both of those stories. And a lot of people that I do speak with on the podcast, it comes from trying to solve their own health journey and coming from that journey and going into, I want to help other people as well. And I love that approach. It's always been a service first within this industry, especially seeing more and more proactive sort of health alternatives, if you will. Walk me through, both of you guys, really quickly for everyone out there. Quotient Health offers so much out there for teams and organizations, for leaders and for individuals as well. What do you guys do and really focus on to help someone starting their health journey?
I think, Eliot, at the end of the day, it's kind of like the healthcare that we think that we all deserve. If you're imagining what the healthcare a Fortune 10 CEO might get, you're kind of thinking about that, right? Like, they're not just doing a quick annual check on this guy every year with some blood tests, although we could argue that maybe that's what they were doing with President Biden with some of the recent news. But that really inclusive, turning over all stones, trying to see everyone's blind spots up front, so we can manage health more holistically. We want to really democratize access to that type of care for everybody. I'm going beyond what you might imagine a VIP physical would be or an executive physical. A lot of people will go out to a place like Mayo or the Cleveland Clinic. They'll fly in to get that type of experience. We want to bring that experience to each individual's hometown where they can go and have that really comprehensive evaluation that covers all the touch points that science says are related to all-cause mortality and longevity. But a big disconnect with some of these executive health programs, there's very little follow-through. There's little strategy on how to actually optimize from there. You get a big data set on, here's how you're doing today, but then you go back home and there's not a whole lot of, well, what do I actually need to do to optimize? So we've built some really cool frameworks to kind of gamify this for folks so they can manage their health in the same way that they might manage their business, with some KPIs that we know that science indicates are the things that are the most important for us. And we kind of help patients then follow through based on the learnings of their physical, which is very comprehensive. We can talk about that a little bit, to really drive performance. So it's both health span and lifespan that we're trying to target. It's not just how long you live, but it's how well you're living, making sure that people are at their peak performance today and for as long as possible, basically.
And it was an opportune time when we first opened, sorry to interrupt, with the emergence of AI and an easier way to kind of integrate these data analytics. We hired a biostatistician from the Cleveland Clinic to join our group to really focus on the science, because I think in the past, our integrative and functional medicine colleagues had done a really good job of really looking at prevention from their own experiences. But a lot of the data that they were using was more anecdotal as opposed to science-based. And not for any fault of their own, there just wasn't a lot of information out there at the time. But over the last decade or so, there's been a lot more investment, even at the NIH level, in the longevity space. And so the information we can glean from actually well-done clinical studies and provide that information to our patients is something that is unique to this time frame. It's a really fun time to be a part of this, because we can take our science backgrounds and really dig into that science and then bring that to our patients. Because again, most people don't have the time or the bandwidth to look at these clinical studies and really glean what is the most important part that's going to affect me personally. There's a lot of experts out there in social media, and it's really hard to figure out who's telling the truth and who's not, who's selling what product and who's not. So we're really coming at this from a pure scientific glean to give patients the best advice based on their personal data. So it's integrating data analytics, AI, personal medicine, and preventative healthcare all in one. So it's a pretty powerful tool.
Absolutely. Like I've spoken with you guys beforehand and kind of dove a little bit more into Quotient, and the personalization approach we're seeing more and more often, and we need to see it more and more often. And I love that you guys take that extra step that we're not quite there yet for everyone, but you guys take that extra step, not only showing what the personalization is for that particular client, but also, hey, what do you need to continue doing in order to really optimize your health? It's almost like we always say, when you're starting a business, find a need, fill a need. It's like, okay, but you're not telling me anything else. So for all these people who want to start a business, for example, they have no idea what need they need to find or what need they need to fill and how to do that. And you guys are finding that solution in someone's health journey. Hey, this is a need that you have within your health journey, and this is how you're going to get there. This is what steps you actually need to take. So from any of the stories that you guys have with some of your clients, have you had a client whose journey through your wellness program significantly changed their organizational organ?
Well, I think it's important to note that it's not just finding the needs or the areas that need to be changed, but it's creating a framework with which they can be consistent, because consistency is really what changes or shifts that barometer. I mean, you can talk about the science all you want, you can do all the labs, you can do all the biometric testing, but if you're not doing the work and you're not getting that done, that's the secret sauce. And I think that's, again, where a lot of concepts like this fail, especially the virtual kinds, where you see a floating head on your computer screen that tells you, here's your labs and here's what you should be doing. But again, there's no follow through and there's no personal touch. So I think that's where our model really shines, is in addition to coming in to see your primary care doctor, you're also going next door to see a physical trainer and nutritionist, and they're going to put in the work and show you, hey, you need to start deadlifting. Here's the correct form, and shift that and change that in real time, and check in every 8 weeks and make sure that you're doing what you're saying you're going to do. At least for me, when I go to my primary care doc once a year, they say, are you exercising? Yes. Okay. And then that's it. But they don't know what I'm doing or if I'm doing the right kind of exercises. And so I think for a lot of our clients, that's where they find, really, to be honest, the most value is those real personal touch points where they get encouragement. They got accountability buddies that are always checking in. And so I think that's where a lot of, especially corporate and really busy people who have families and work and everything else, it's finding that time to connect with an individual human being that they know and they have a relationship with, because I think that accountability is much more powerful than, again, floating heads online and virtual platforms where you don't know them and you're not really beholden or care what their opinion is. If you didn't do your exercise, who cares? I don't know. So I think that's where we've seen the most benefit in the space, is bringing that personal care and personal touch. So that's unique.
Working with a lot of leaders, that especially entrepreneurs or business owners or high executive leaders within the spaces, have you find it easier or harder for them to really be consistent on what you guys actually provide to help them in their health journey?
I think there's maybe two angles to that. One is, people that are high achievers like that are often really busy in their lives, and it's hard to fit additional work in to their already super busy schedule. But on the other side of that coin is, I think a lot of folks who are in those types of positions tend to be goal oriented and have a big drive to change and improve. It's often what leads to success in any industry that you are participating in. And so I think leveraging the data and almost gamifying it for people is really powerful. So after you come in to work with us, it's a full day exam. You're with us for 6 or 7 hours on the first day, and spend the morning fasted. We're going to do labs and a whole bunch of additional testing during that period of time. And then they change into gym clothes in the afternoon. They go to our gym, and there's a big set of physical testing, strength and stability, and VO2 max testing to understand someone's cardiopulmonary fitness level, et cetera. And then we're taking all this data and we're distilling it down into basically these very simple frameworks for people to look at. And for example, one is called the Core 5, where we look at the 5 main pillars of health that drive all-cause mortality and longevity. There are also things that you can change. There's some things that you can't change. We'd never put someone's genetic profile, for example, on something like that, because it's immutable. You can't do anything to it. But your cardiopulmonary fitness level, your strength level, your metabolic health, your atherosclerotic cardiovascular disease risk, your sleep architecture, all these types of things we can actually change. And it is the feedback loop. So people can make a change and then see the actual impact on their dashboard with these areas that they're trying to improve, is going to kind of help to create that feedback loop to change behavior. Because ultimately, a lot of this is about behavioral change. There's got to be a cue, and you've got to do something. There's got to be a reward. And, there's some rewards that are just built in biologically. But I think for a lot of high achievers, it's nice to actually see something move that's on a chart, or it's a dashboard that they have, and they can kind of see this. Just like if you're running a business and you run a new marketing plan, you might see that your customer acquisition cost goes down, or you might drive more revenue. Why don't we do this for our own health? Why don't we look at this from the perspective of my body is something that I can manage? There's inputs and outputs. And if I'm optimize the inputs, I can get better outputs. And that's going to make me feel better today and live longer long term. So this Core 5 is like a radar diagram where we want to expand this pentagon out into all the perimeters. So each of these 5 aspects of health is getting better through the interventions that we provide. Again, all this data is ingrained in through our full day Q diagnostic testing. And then we have a longevity quotient as well, which is your singular North Star metric for health. It's like your credit score for health that our biostatistician that Justin mentioned before created for us. And so you also have this one North Star metric to drive forward. So it's all to say that the clientele that we tend to work with, I think, is going to be really motivated to drive change that they can see. And this model is one where, unlike getting a blood test every year and things don't really change, there's not a whole lot of action. This is like, we want to improve our system, our body as a system, in order to drive better outputs. And I think we've create a really good way to do that.
Absolutely. I love myself as a business owner as well. Like, I love to see all the data right in front of me and kind of see, okay, what's working and what's not. Just like you mentioned on the marketing side of things, like when you get that dashboard and you see, okay, this is all of the data in front of me. this is what we're starting, and this is what we've seen after a month, 2 months, however long it is that they're within the program. Have you guys seen, do you have an incredible success story from one of your clients that kind of helped them not only build their own system in their body to be completely optimized, but also kind of translate that into their business and their teams?
Yeah, I mean, I can think of someone that we work with even as Quotient was just in its very infancy, someone who I went to school with, someone who's a really close friend of mine, actually, who came in town to visit. And he had noticed that I had changed a lot because I had kind of adopted this protocol in my own life. He's kind of like, man, what's going on? What are you doing? And, we kind of went through the protocol with him, and he is a super high achiever, incredibly brilliant guy. And he implemented a lot of these things and built habits with these rewards and just kind of stacked these habits one on top of the other, each kind of very small, until it became this complete change in his lifestyle. Got fully engaged in all this stuff, was measuring his body, measuring the outputs of his body, and really transformed himself. He probably, not that weight loss is a key thing. Weight loss is probably important because it is, it's a lever for metabolic health and, probably lean mass and strength and all these things we know that are important. But he did lose probably 60 pounds, 70 pounds, transformed himself, moved on to actually a new business that he's now super engaged with, and is actually very involved in the healthcare and wellness space now, because it's been such this important cornerstone of his own life that a lot of the companies that his firm now serves are folks that are in the healthcare space. And so just a little anecdote about someone that used protocols to really change their personal life, their health, but then seeing that translation into their career as well.
And to piggyback off that, I would say that to give you small examples of where wearables fit into our program as well, because we all have them. We're in an Oura Ring right now. I've got an Apple Watch. Those are also siloed as kind of data points too. So in order, to give you kind of examples of success in translating data to real life scenarios, we've created a platform that brings in the data from your watch, your ring, your CGM, whatever devices you're wearing, all get kind of amalgamated into this health home that you can track in real time. And you can also stack functions. So to give you an example, if you have a patient that we're concerned that might be pre-diabetic, and we're seeing significant spikes in their CGM after meals, we tell them to go on a 15, 20-minute walk after, let's say, dinner. And then we can stack their Apple Watch data with increased activity over top of CGM data post-meal. And you can actually see, when you walk versus when you don't walk after a meal and how much your blood sugar is affected. So that objective data is really powerful for people. And we've seen big aha moments when people are like, oh man, a simple walk can significantly improve my metabolic health after a meal. It's such a simple thing to do, but now that they've seen it on their they've seen their data on an app, it's like, oh wow, okay, I could do that. That's easy. And there's a reason for me to do it because I see it in real time. So I think even those little things across lots of patients can be very impactful long term.
For sure. And just to build on that too, it's part of it is seeing the change in, yes, my blood sugar is low if I take a quick walk after I eat. But unless you're empowered with why that matters, it's like, okay, great, it's a little lower. But when someone's empowered with the information that less than 10% of our country has actually true metabolic health, if you look at, a variety of factors that would kind of come together to define good metabolic health. And then you understand further than that metabolic health is probably, or poor metabolic health is a foundational problem, not just to get diabetes, but for cardiovascular disease, for cancer, for neurodegenerative disease. It's just, once you see the information and you see the impact of improving your metabolic health, which is effectively your ability to intake energy, utilize energy, and do that in a balanced way. Once you understand the impact on what that's actually going to do for your life, your ability to be around for your grandkids, your ability to thrive in that period of your life, it becomes a lot more important. Like, okay, I will take that walk afterwards, or I am going to think about how my training program impacts this, or what I'm doing with my nutrition to impact this. So, this is the Primal podcast, right? So I think you're into a lot of the things that are like very foundational, what were cavemen doing to make sure they were healthy. And maybe we should be doing a lot of those same things now because our biology hasn't changed all that much against the backdrop of evolution in such a small amount of time. But what I would say is technology enables us to leverage these very primal things because it gives us a reason to believe. It gives us a reason to understand why it's important, how it impacts us, and then to see the impact in real time. So the combination of those super primal things with very modern technology is where the magic is.
Absolutely. I could not agree more. And it is called Primal Reset, myself included. I'm very into kind of finding that root cause within our body to actually get it optimized. And with the more technology that we're seeing nowadays, it's becoming more and more possible. Because when we say, I mean, even, your parents or grandparents would always say, oh, I ate that as a kid, even just dietary wise. It's like, okay, well, you ate that as a kid. It's still here, but let's look at the ingredients for when you were a kid and now. And it's an entirely different thing. So with that technology, we're actually able to find out what was in it, back then and why that was in it and what the ingredients are actually going to do for us and really the root cause of what's happening inside of each and every one of us to actually optimize our body. I mean, you guys there's a lot to unpack here, kind of mentioning the technology with the advancements in health technology. Where do you see these corporate wellness programs heading within the next decade?
Well, I mean, I think I would like to hope that we're going to see more localization or co-localization of these programs in the cities where the businesses exist. And I would also like to see it move from the big mega healthcare systems to more private agnostic providers that don't necessarily have incentives to drive revenue for a big mega system in the reactive care model where there's fee for service. I think that there's a huge opportunity for practices like Quotient that are providing this outside of the traditional healthcare system while still staying true to all the science that is foundational to the decisions that we make. These individuals can stay close to home, can get comprehensive testing, and then get the follow through on the strategy and what they need to do from there, and do these things within a practice that isn't necessarily also an engine for fee for service care, because we do live in a reactive healthcare system within the U.S. and all the incentives point towards doing more. Unfortunately, I mean that's just a reality of business models of major mega systems. And don't get me wrong, major healthcare systems do a great job of taking care of really serious problems. When there's a bad diagnosis, you need to go see that oncologist. If you have a traumatic injury, we need those trauma surgeons and critical care experts. But I think that, yes, there's been a lot of advancement. And if you are sick, we can really manage these things exceptionally well. But we've kind of lost sight of what you propose, which is getting towards the root cause and trying to angle towards that to prevent a lot of these things from happening. And to me, I think that there's a natural opportunity for this to occur sort of outside of the traditional health with close linkage to the traditional healthcare system. So Quotient Health is obviously we're all about prevention and proactivity and driving health span and using every possible tool to do so that science supports. But it doesn't mean that we're like isolated. We're going to have close partnerships with those experts that we think are going to be able to provide that advanced care when that time comes for our clients, and doing so in a way that isn't beholden to any single system or even city. So we can give our clients the opportunity to go see the specialists that we think will best serve them, and then kind of walk through that with them as they deal with whatever their major diagnosis is.
And I think that's the way to go. Think when we talk about preventative health, when we talk about optimizing your body and kind of finding those root causes, and it sounds like we're almost veering away from that Western system. And at a point we are, but at the same time, there's a need for the Western medicine and Western healthcare to be able to have them kind of on call. And if something is severely wrong within our bodies, like we need to be able to go see them, whether it's a surgeon or whether it's a certain medication that, is dire for what our situation might look like. I think working with the Western side and combining that functional preventative side at the same time is really what our future should look like, or in my opinion, should look like. And hopefully that we will see in the future as well. When you guys mention, and I love what you guys are doing, it's definitely different than a lot of other corporate wellness programs that we've seen. Kind of everyone says, well, if we take a retreat, or if we just, do a pizza party, that's our corporate wellness, and that's our corporate wellness program. Everyone's going to feel great. Everyone's going to like our company. You guys have traveled to a lot of different places, and you've got a lot of different places upcoming this year as well. What's your favorite retreat or workshop that you guys have done? In what area, or which one are you looking forward to the most?
Yeah, I think my 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 vision for the future for some of these retreats within Quotient Health is going to be kind of these Misogi challenges, where you bring in clients from our program, and you go somewhere to really challenge them physically and mentally, because I think we live these kind of cushy lives, and while we work out every day, and we push ourselves in that short time window, I think a more formal retreat where you can really get outside your comfort zone and do something that you have a really high probability of failing. That's being a business leader involves failure. I mean, that's where you learn the most, and I think that's great for your business side, but we don't fail enough on the physical and mental side a lot, and I think these types of retreats can be really powerful to kind of help individuals grow. And so I think that's where we'd like to focus our attention in the future, because it's fun to go to longevity retreats and do yoga and drink green tea and talk, but it's a whole different thing to get into the muck and get dirty and get sweaty and fail. So I think that's a much more powerful approach. So those are the types of retreats that we're looking forward to.
Absolutely. And reflecting on both of your guys' journeys starting Quotient Health, what was a significant challenge that you both faced in starting Quotient Health, and how did it shape your approach to corporate wellness?
Well, I mean, I think one of the major challenges is, and I've been a part of this in the past too, is when you're kind of creating a new category, so to speak. It's not just a better version of what exists. It is kind of a different model. It requires a lot of communication to clearly state what we are building and what we're doing and what the benefits are. And that's always a challenge, trying to get down to distilling the message to something that's very easy to understand. And I think that we're getting there. I mean, we're using some anchors of what people are aware of. So, you heard me anchor to executive health or VIP physicals, concierge primary care. And it's kind of the synergy of those two things that come together, where it's 1 + 1 is more than 2. And sort of combining these different aspects is going to provide a lot of incremental synergistic value for the people that we're caring for. But again, when you're trying to create something that doesn't really exist, and it's a new model, and it's not all that easily anchored to what people know about, and it kind of cuts across what people are used to, which is I go to my doctor when I'm sick, versus I'm going to go to my doctor because I don't want to become sick in the future. That's a message that requires a lot of art and effort to get out to enough people to build a business.
And I would say that it's been surprising, the feedback we've gotten from especially businesses. You give them kind of this pitch and you explain what we do, and the lights go on in a lot of these guys' heads, and they say, "Gosh, this is so much different than what we've been offered in the past," or "This is so much better than what we've done in the past." And so a lot of companies have not only agreed to come on board, but have increased the amount of executives that they want to participate. Even though potentially the price points are a little higher, they're like, "Oh, we see the value here. We understand that this is going to be something that our C-suite is going to really enjoy and getting value from." So I think that's been the biggest surprise. It's easy when we send personal emails to friends or colleagues and we say, "Come join," and they're like, "Yeah, we're all in." But to see large businesses say we want to bring in dozens or even hundreds of patients, that's pretty powerful.
Yeah, I to build on that too, I would say I agree with Justin 100%. While it's hard to create a new category, when you explain it to someone, it's kind of like, of course, it becomes obvious, right? It just happens to be different, and that tends to mean that someone's on the right track.
Funny enough, I was in Germany recently visiting my grandparents for my grandpa's birthday, and we were up in the mountains having lunch. Good time. There's only one restaurant there. This is in May, beginning of May. And I actually run into a big group, and I won't mention the name, but run into a big company who actually had a retreat at that restaurant, and they were hiking up the mountain later that day as well. It kind of just ran right into them. So we've definitely seen corporate wellness explode within the last couple of years. And to all of your guys' points, I mean, it's a need that you guys are filling that wasn't really thought of beforehand. It was kind of, when you were in school and those pizza parties and that's your corporate wellness, or you're going on these retreats and doing yoga and drinking green tea and just talking your feelings out and whatnot. But is it really helping? Is it really finding yourself and finding your health journey personally with your group to actually make yourself better and your company better as well? And that's something that I would like to see more and more into the future. And what you guys are doing is phenomenal. One of the last questions I have for you guys as we kind of wrap this podcast episode up, what's the very first step that you would recommend someone taking as a high net worth individual, a high success leveled individual, someone that's either running a company or a top level executive? What's the first step that they can take into their health journey?
I would say measure one thing. Pick one thing to start measuring, especially if you're kind of coming at this as a new process in your life. Pick one thing to measure, whether that's the number of fitness training sessions that you do on a year, whether it's the quality of your sleep. I think being artful about picking the right metric is important, of course, but starting small, picking one thing is really achievable, and it's something that you can build on and stack over time. But unless you're measuring something, it's really hard to build new habits and to build the lifestyle that's going to help you to perform at your highest level and optimize your odds for long-lasting health. So starting small, a singular goal, building a habit that's totally achievable. And there's lots of tricks to kind of hack your brain to build a habit that are well studied and well established. But if you can start small with just a single thing, measure that one thing, and then build the habits around it, and you see results, then that's when things tend to snowball in a really positive way for people. So start small, start with measuring one thing.
I like that. And to the point of awareness and getting more of this information out there and sharing with everyone more information about what you guys do, also what can affect themselves as well as their businesses. Where can people find more information? What's your website, social media handles?
Yep. So we're on LinkedIn, Quotient Health, and then website is going to be quotient.health. And that'll give a lot of information about what we're building. Our flagship location is here in Cincinnati, Ohio. We have plans to build to 20 to 30 locations, primarily in the Midwest and Southern US over the next few years. So hopefully we'll be coming to areas closer to your listeners over time. And also important to add, Eliot, that we're not just a business to business corporate health company, but this is absolutely available to individuals as well. Anyone that is interested in this kind of area, maybe you're an entrepreneur, maybe you're whatever you are, whatever industry you're in or job you have, this is available to just individuals as well. So yeah, hopefully we'll be coming to an area close to your listeners over time here over the next 3 to 5 years.
Well, I'll have all those links in the description below. Like Ryan said, if anyone out there, whether you own a business, you don't own a business, or you're looking to start that first step in your health journey and bettering yourself as well as what you're doing in today's society, go check out Quotient Health. I'll have all the links below in the description. But Ryan, Justin, it was a pleasure having both of you guys on the podcast today.